Well, today I am speaking with Kirsten Wyffels. Kirsten, will you share a little bit about yourself, introduce yourself?
Sure. So, as Marianne said, I'm Kirsten Wyffels. I am a nurse practitioner at Winneshiek Medical Center, Mabel Clinic, right here in town. And I have been here for 7.5 years already, which just has flown by. And I am a nurse practitioner. I have my Doctor of Nursing Practice degree and my master's degree, and also my bachelor's degree in nursing. I kind of worked my way up. And so what's unique about Mabel Clinic is it is a satellite clinic of a larger hospital and clinic in Decorah. And so we started here full-time 7.5 years ago. And so it's been a lot of fun and exciting, but we had previously been open only a few days a week. And so they decided 7 years ago to open full time, and here we are. And we have the same staff that we started with. So we've had 0 turnover. So that's been very fun and actually really a good thing, because when people call here, they know who they're going to talk to, who they're going to get, and that's important because people are always wanting their healthcare provider to be stable and they don't want to have to switch. So a lot of times everybody would ask me, are you staying here? And I'm like, I live in Mabel, I'm staying here. So
Awesome. What is your favorite part of working there?
I appreciate and enjoy taking care of my community. So, and that comes with challenges too, but I enjoy seeing people. I also always have to remember that they're here because they're ill and they need to be seen, that they're not here just to want to visit and talk to me. So, but my favorite thing is just caring and taking care of people and watching families grow and watching little babies grow. A lot of times I will see babies at 2 weeks of age, and I see them through their kindergarten shots, through their sports physicals as a teenager, and watch them graduate from high school. So I haven't quite gotten there yet because I'm not been here long enough, but that's what I probably enjoy the most.
What makes your organization unique?
So I alluded to this a little bit. It's very confusing a little bit because we are Winneshiek Medical Center, but we are associated or affiliated with Mayo Clinic. And so people with Mayo Clinic insurance, even though we're not, and I'm not a Mayo Clinic employee, their insurance is still good here. And so they're within their, I'm trying to think, their coverage with their plan. But it's interesting because people think we have access to Mayo Clinic records, but we don't. So we're a little bit unique in that aspect. And really not many towns, and I hear this all the time, people will come from the cities because they're here camping, or you're so lucky to have a clinic full time here in a town less than 1,000 people. So our main organization, Winneshiek Medical Center, has really invested in our community, and we are very fortunate to be able to be here and be open and be here full time.
Kirsten, tell us about some different career opportunities.
So at Mabel Clinic, we have a scheduler, but also she is cross-trained to draw blood. So she also draws blood, she answers the phone, she does anything basically that we ask of her. And then we have an LPN that is here. Now, if she is gone, sometimes we have an RN here, and then of course myself as a nurse practitioner. But you see more diversity when you go down to Decorah quickly. You have radiology techs, you have physicians, radiologists, personal service representatives or patient service representatives. There are schedulers. We have medical assistants, like I said, nursing staff, including both LPN and registered nurses. We have people in the maintenance department. We have administrative assistants. We have quality assurance people. It's a whole variety of people. And accounting, we have accountants, of course, that are here. Also, people who are trained in billing and coding. That is a new and upcoming role that is very important to clinics for their billing and coding. And so usually those are like a certification, but there are very entry-level jobs. You can come in even as a volunteer, but like our scheduler, or a HUC, health unit coordinator, whatever you want to call them, they all have different names. They trained her to draw blood. It wasn't anything that she went to school for. They trained her, and she does a fabulous job. And I have a couple of patients like, she deserves a raise because she does such a wonderful job. I've been other places and they poked me 7 times. So it's interesting what you can learn just by getting your foot in the door, and you can advance within the clinic itself just by starting at certain levels, and then they'll train you to do other jobs.
Kirsten, how does your company invest in the employees?
Well, that would be another kind of to offshoot off of that. They train you to do other jobs, and so you can do that within the facility without having to go for outside training, just on the job training. And also like financially, how they invest in us. Of course, they contribute to my insurance, my 401k. As a nurse practitioner, I have to have so many CEUs, so continuing education credits. So I have to go and have 75 credits every 5 years. And so they provide me with a allowance every year to go and have training. So, and you can, for me, I can pick up kind of whatever I want to do or what I'm interested in. So that's, for me, that is beneficial and appreciated, because otherwise it's hard to be able to take off of work and to get those things done to maintain my license.
So you said that a person can learn on the job some other skills. What kind of training or education would you recommend a student have in order to be successful in a clinic like yours?
Oh, it all depends on really what they're interested in. At Winneshiek Medical Center, which is a little bit unique, is that they hire licensed practical nurses, so LPNs. So it's not a 2-year RN, it's a 1-year program. So if you wanted to go the nursing route, or even you could be a medical assistant, and that's a whole different training. But you can go to school and work up the ladder. There is some tuition, like a tuition investment program. You get so much money a year to kind of take some more classes to work on your degree. They do that, like even the phlebotomist. So for example, at Mayo Clinic, they have a whole, I think it's a 6-week, 3-month program. They teach you how to be a phlebotomist. And Mayo Clinic is, of course, in its own entity. But at Winneshiek Medical Center, you can just get your foot in the door and they'll train you. So it really is dependent on what area you go into. Some are just entry-level jobs. You don't need any certification or college background. If you want nursing, then you have to have some sort of background. But even if you wanted to be a scheduler or an administrative assistant, that a program specializing in those things would be helpful.
Awesome. What else would you like students to know about your business or position?
Oh, I love my position, and I would say, and I will probably will speak more at a nursing, the nursing jobs, because there are so many things that you can do with nursing, not only at Winneshiek Medical Center, but just abroad. And I would recommend, there are 2-year programs, 4-year programs. Of course, I am a proponent, or I'm going to recommend the 4-year program, because it opens up many doors for you. And but a lot of people want to do the 2-year program, get their foot in the door. Sometimes Mayo Clinic or other organizations, Gunderson Lutheran, that are around here will support you to have you go back to get your 4-year degree. And so that's but Mayo Clinic wants you to have a 4-year degree. So that's a little bit different than the registered nurses that are at Winneshiek Medical Center, but every organization is different on kind of the hierarchy, what they want for their nursing staff, because there are certain things that an LPN can't do that an RN can. And even as a 4-year RN, there's more leadership opportunities for them to advance in than your 2-year RN. So it goes into scope of practice and licensure, but there are so many jobs in nursing. And one thing I did not talk about is computers. So anybody who is interested in computers, your IT people, we call them weekly, if not daily, with things that are happening. And so, because we are very dependent, unfortunately, on technology, computers. One area in healthcare that we have seen actually go away are our transcriptionists. So there are very few transcription people anymore, because everything is, I either type or I dictate my note with drag in text, and I can just speak and it'll just type on my screen for my note. So that's a part of healthcare that used to be very, very popular probably 10, 15 years ago, that's almost obsolete now. So it's interesting how technology has kind of taken over that. So,
speaking of technology, can you
Yeah.
tell me about some of the unique technological tools or equipment?
Well, so it's interesting. So I can use my iPhone, and I have an app, if I can find it, which I probably won't quickly enough, but it's an app on my phone. It's called Nuance, Power Mic Mobile. And I can speak into that and it'll dictate my note. So I can dictate a letter, and so that's probably the most time efficient tool that I have, that's been helpful for us. And of course, our medical records are now different. We changed to a new program 3.5 years ago, and so that has been very interesting on how you can store little pieces of information. You can put a post-it note, like I can remember, okay, so-and-so last 6 months ago went on vacation. I want to ask her about that vacation next time. I don't use those notes, but it's really interesting what is in and available within the EHR, the electronic health record. So, but I like the tool with my phone.
Kirsten, what would you tell your 18-year-old self?
Oh, 18 years ago, not 18 years ago, but when I was 18, that was a long time ago, Marianne. I will tell you a couple of things. Is what I'm glad I did is I went to college right away. And I went to South Dakota State. I was going to be a pharmacist. And I decided 2 months in, like, nope, that's not what I want to do. I want to be a nurse. And so I transferred. And it was really interesting because I think how scary that was. I wasn't even scared about it at all. And so don't fear change. Don't worry that you make the right decision when you're 18, because you can change your mind. You know, that I know there's a lot of pressure when you're 18, like, what are you going to do with the rest of your life? And of course, that's the first question. Well, what are you going to do next year for those seniors? What are you doing next year? I don't know, you know, and so it can be very stressful, but don't fear challenges. You know, take that extra science class, that extra math class. Yes, full disclosure, my husband's the math teacher, and so I'm always a proponent of math. But, you know, just because you don't think you're going to use advanced algebra or trig and calc for the rest of your life, you probably won't. But I had to take statistics classes and things that I never had to in high school, but it teaches you how to think and how to study. And so taking those challenging classes, don't worry so much about your GPA, but take those classes to help you advance into your next step after high school. So, but try not to stress out too much about it, because you have many years after high school to kind of figure it out. And sometimes it takes people, sometimes people's paths are straight and sometimes they are bumpy, and that's okay, because we all get to a destination differently. So there's no right or wrong way.